The following segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.
Welcome back to Loving Living Local. I'm Gretchen Wirtz, and today we are getting healthy here with Solvera Health. And joining me today is a nurse here from Solvera Health. She's a new employee there. Amber Brightsman, thank you so much for joining us.
Thank you.
You are joining in urology. You're a nurse. What is APRN?
So it's advanced practice registered nurse, so nurse practitioner for short.
In urology and sexual health. So tell us, you've been doing this almost 30 years, you've been in the medical field. What brought you to Solvera Health?
So after being for 30 years, like you talked about, so starting out in pharmacy at a compounding pharmacy when I was 16 and did some inpatient pharmacy and then to CVS pharmacy as a district trainer, opened most of the freestanding CVS stores. Went back to school at Bradley University for nursing and then worked at OSF St. Francis Level 1 Trauma Center, as you know, on neuro ICU for brain and spine injury.
So you've seen a lot.
Yes.
You've done a lot of different things.
And then graduated with my nurse practitioner in 2017.
Wow,
did urgent care for a while, hospice, palliative care. And then for the last 4 years, I focused on urology along with sexual health. And most importantly, Solvera has the commitment and the core values that I've always held dear for the last 30 years. Mostly seeing the final need that we really, really need in this community and elsewhere, and that's hospitality. So much healthcare is turned into a number that you are turned in and out in 15 minutes. Regardless of what your condition is, and they don't just see them as patients, they actually see them as a human being.
As a friend even.
Yes, exactly. And too many times they're just patients or an organ or a problem, not a person. And every person that is a patient is a patient that's a person. And we ourselves have been on the other side too, whether it's ourselves or with our family. And under one roof, I have the ability to have collaboration not only with a great pharmacist, also physical therapy, Dr. Fox, who specializes in women, and also with Dr. Patterson, who has an abundance of experience as a urologist, along with family medicine in the same building. So it's very convenient for the patient. It's very helpful for them. And it's helpful for us as professionals to collaborate with each other to make sure that we're on the same page and that we can do the best for them and that they feel like they're all consuming in one place together.
You're meeting their needs, you're finding a solution for them, not just checking a box and getting them out the door.
Exactly.
Urology very much needed in this community. Real quick, tell us why that is, and specifically sexual health education, I'm sure.
Yes, so urology is a huge need in this area. That encompasses anything from recurrent urinary tract infections to interstitial cystitis, which is a big fancy word for bladder pain that's chronic, to erectile dysfunction, low testosterone, male infertility, bladder cancer. I have also specialized a lot in prostate cancer, whether it's localized or metastatic. So it's a lot of different areas that are really, truly needed in this area.
Sometimes not everyone wants to talk about it, but it's definitely something you need to do. And going to Solvera Health and Amber, of course, you're going to get that comprehensive care that you need with the friendship. And you can go to solverahealth.com. You can call them at 855-476-5837. Welcome to Solvera. We're glad to have you, and thanks for coming and talking to us today.
Thank you so much.
Yes. All right. We got more coming up. Keep it right here.
The preceding segment contains sponsored content. The opinions and views expressed belong to its sponsors and not those of Nexstar Media Incorporated, this station, or their affiliates or employees.